Welcome to OTCA Meditronics company. Today we are going to demonstrate how to use bubble air mattress, or we can say medical air bed. This bed is utilized for the prevention of bed sore in bedridden patients. Those patients are ICU admitted or they are home isolated and they are bedridden. In that case, they need to change the skin position, otherwise they will have the issue of bed sore. Bed sore is a very critical condition to the patient. So it is recommended at all the patients, those who are in bedridden, they are on bed for 24/7. We recommend use to this air bed to prevent bed sore. So we have taken one air bed. Here we don't have a bed, but we have tried to explain how to use it. First of all, we have taken one air bed, which is of good quality, Health Touch Medical Air Mattress. You can see this is the mattress. This is the compressor. We have unboxed. We have received this mattress. The mattress thickness is very thin. You have to keep this mattress on the mattress of your foam mattress on the bed. This mattress will be laid on your existing mattress, and you can keep one small or thin bed sheet on this mattress. Okay. Now this bed comes with this compressor. After compressor, there are two outlets. We have to connect this tube from this to this airbed inlet. Now you can see these are small bubbles. Okay, you can adjust the controller of air to provide a firmness and tightness of the bubble. If you will keep it at full, it will give more air to the bubbles. Now there are two outlets of the compressor, you can see, but at one time only one air outlet will work. After 10 minutes it will replace the outlet. So you can see we have disconnected this tube and mattress has start reducing their air, or air is going out of the mattress. So this is ultimately a alternating pressure pump. It will alternate the pressure of air from one bubble. After 10 minutes it will initiate or inflate another bubble cycle. So we have to connect this tubes to this compressor. Make sure you are keeping this compressor running for 24/7. If you will switch it off, all air will be leaked and reduced, because this mattress is having air outlets and you have to keep this air flowing through the mattress. You have to keep this device on 24/7, otherwise this mattress will be deflated and it will be of no use. You can see now you can see one bubble is there which is soft and one is a tighten. So it will change the position. Whenever you lie down on this mattress, one cycle will be on the lower side and one cycle will be higher side, because at a one time only air, one cycle will be inflated and one cycle will be deflated. After 10 minutes it will replace. See, you can see this is soft and this is hard. So this cycle is deflating and this is inflating. So this is the phenomena how you can use this bubble air mattress. The name of bubble air mattress is alternate pressure pump. So for first 10 minutes it will inflate one cycle. After 10 minutes it will inflate this cycle. So you can see this is soft, this is hard. So this is how the air bed works. Make sure you are running your air mattress for 24/7. Otherwise there is no use of air mattress. Thank you.